This is what we call the hero story. 70% of Americans are either overweight or obese. We've never had such high levels of chronic illness of kids. The next generation, teen obesity, kid obesity, it's ridiculously high.
There's not enough people talking about the holistic approach towards GLP medications. We were literally taking patients, using these medications and peptides, achieving weight loss, weaning them off, and they're maintaining it.
When millions of people take it for a long time and you see no side effects, no long-term side effects, that's when you feel comfortable. And I'm going to give an example of a weight loss medication. Meridia was an SNRI. It was a weight loss medication closer to the phentermine type that was FDA approved back in 1997, 1998. FDA approval. It was touted as the most amazing weight loss medication. It's going to change the world. 10 years, around 2006, 2007, it was pulled back because they started an increased risk of heart disease and vascular heart disease. It took 10 years for that to come out. Even when a medication is FDA approved, it doesn't mean that it's safe. It means that it checked it on maybe 200, 500, or 1,000 people. In the short term, they didn't see anything wrong. My proof for my patients, I always tell them that. I want to wait at least 10 years before I'm going to use a medication because that's when I feel comfortable. Well, GLP-1s have been out 18 years.
Wow. Yeah. So what a story. What a story. One thing that you said that I really want to talk about, insulin resistance. So I've been under the impression this entire time, and this is why I have you on, because you're the expert here with the medication. It's not addressing the actual basis of insulin resistance, but you're making it sound like it is. Can we talk about that without getting too in depth for everybody listening? Because we know what insulin resistance is, a condition where the body's just no longer responding to insulin. And we know what causes that, lifestyle over time. But how do the medications directly, not because of the effects of lifestyle? We know it, you eat less, that's going to help it. But is there a direct mechanism outside of your lifestyle changes where these medications actually address insulin resistance? Because that's news to me if that's the case.
Yeah, listen, 100%. So when you think about insulin resistance is in a spectrum. So insulin resistance usually starts with, there are genetic predispositions. There are some people who store more fat in the belly fat, the visceral adipose tissue. But the more fat, the more visceral adipose tissue you have, the more your cells become resistant because of the inflammatory cytokines secreted by the visceral fat, the adipokines. So when you have insulin resistance, it starts from an increase in visceral fat. Then that goes into where the cell becomes more resistant to insulin. So the level of insulin has to go up to be able to dispose of the same amount of blood sugar. After a certain point, the cells almost do not take any more insulin